Hi there, my name is Matthew and I'm your nurse today. I'm going to be changing your sterile dressing. Can I get your name and date of birth? Perfect, Mr. Smith. So I have identified Mr. Smith by his name and date of birth and by his wristband. I've also checked the chart prior to coming in about this dressing. You got any allergies? No allergies. What's your pain scale today? 0 being the least, 10 being the most. Perfect, you're in no pain, great. So if Mr. Smith's pain would have been 5 or better, I would have asked for a pain medication from the doctor, and we would administer that and came back 30 minutes later and then reassessed the patient, making sure that it was below 5. So I'm going to change this dressing today. I'm going to perform some hand hygiene here real quick. Okay. We'll put my gloves on. Now when I take off this bandage, I'm going to hold a little bit of a pressure here just in the middle just to keep it from moving. I'm going to take the tape and I'm going to pull it up starting in one corner, working all the way around. Coming around the other side. I'm going to pinch it in the middle. I'm going to pull it straight up. I'm going to assess this bandage. I'm looking at the color of it, the amount of drainage in it, and the odor of it. Also, I want to assess the wound, make sure that there's no drains in it. There is none in these. I'm also going to throw this away in my biohazard bag. I want to look at the sutures or the staples. If the patient has them, I want to make sure that they are intact and there's no pus or anything draining from them. So Mr. Smith's looks good, so we will proceed to clean and reapply a sterile dressing. Take off my gloves. Toss in the trash. Perform hand hygiene again. I want to pull the top back off of my top of my kit. I'm going to perform hand hygiene just one more time. And I'm going to put on my sterile gloves. We'll put my left one on first. I'm gonna insert. I'm just gonna make sure that when I'm pulling this up that I do not go on the inside of this cuff. I want to make sure that it's up over everything, just like that. With the other hand, I'm going to reach inside of the cuff of my right hand, putting my hand inside. My thumb out of the way, pulling that straight up. I'm going to pinch this in the middle and I'm going to toss it in the trash. I'm going to reach in and get my sterile dressing drape. This is my sterile field. I'm going to lay all of my material out here that I'm going to need, my ABD pad, my 4x4, the antiseptic wipes, and my tape. First, I'm going to take the antiseptic wipe, take one, I'm going to go down the center, least contamination to the most. So we're going down the center, rotating, cleaning each staple suture as we go down. One way only. I'm going to discard. I'm going to grab another one, and I'm going to clean the outside of the wound closest to me. One motion, one direction, one time only, rotating as I go down. I'm going to bring that around. I'm going to drop that in the trash. My last one, I'm going to put in my non-dominant hand. Without reaching across the sterile field, I'm going to reach the other side, rotating as I go down on the outside of the wound, cleaning one way only. I'm going to come back around. I want to discard that in the trash. I'm going to take my 4x4. I'm going to lay it right over the wound, just like that. I'm going to reach over with my ABD pad in the middle, blue line up. I'm going to place it over top of the wound. At this time, that dressing is covered with a sterile dressing. I'm going to remove these gloves just for the fact that it may have some contamination from the wound. I don't want on the outside. Clean wound makes everybody happy. I'm gonna take my tape. So I'm gonna perform hand hygiene again. Put on some more gloves. I'm gonna take my tape and I will secure this bandage. When I break the tape, I will hold pressure. Come down this side. Down this side. And across the top. At this time, I would record my name, date, and the time on this edge of the corner of the tape of the bandage. And also I would put how many sutures and how many staples may be in this wound. I would remove my gloves. I'm going to perform hand hygiene again. I'm going to lower Mr. Smith's bed down to lowest point. I'm going to look at his chart and see what they recommend for his rails. If they need to be up, I'll leave them up. If they need to be down, I can put them down. I would report anything that I've found and anything that I have done today, and make sure that Mr. Smith's call light isn't within reach.